You're watching Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. It's brought to you by SCD Hex, the City of Columbia Office of Business Opportunities, Agape Counseling and Training Center, and Palmetto Media Connections. I'm Tre Tailor, and listen, don't forget to post and share this information out because we want to get the message to the masses, especially about this, because this is such an important and interesting conversation about children, children's welfare, and about an interesting new initiative to really help bring families into the child welfare process. It is a national initiative, Redesign Child Child Welfare to support both children and families. It's been launched, and South Carolina is actually one of 4 states chosen to participate in the Thriving Families Safer Children Initiative, again, aimed at creating productive and safe conditions for children. Emily Parks joins us. She's Chief of Staff at the South Carolina Department of Social Services. Emily, thank you so much for joining us today. I appreciate it.
Thank you, Tre. Happy to be here.
Absolutely. So tell us a little bit more about Thriving Families.
I'm happy to. So Thriving Families is a cutting-edge national program that really seeks to move child welfare systems from what has been a very traditional, reactive, often punitive child protection system to a more advanced system that's designed to support holistic child and family well-being while preventing child maltreatment and unnecessary family separation. So as you shared, South Carolina, we are really excited because we were selected as one of only 4 jurisdictions in the nation to participate in this first tier of this initiative. And we were really drawn to this opportunity because we in social services know that at a time like this, during this pandemic, during COVID-19, now more than ever, our South Carolina families cannot be invisible to us. And while all families are impacted by the pandemic, families in poverty and families who are in marginalized populations are especially vulnerable and are at much higher risk to be left behind during the pandemic.
So is this program specific for those folks that are, as you said, either affected by COVID or in lower income brackets?
So Thriving Families really seeks to dive into community settings and is really for all families because we know, especially in social services, even though a small subset of families across the state come to our attention, we know that all families need assistance at some time or another, right? So we want to seek to wrap around families in community settings and provide those services and supports that help families before they ever get to the point of needing a child welfare intervention.
Right. Yeah, that's so good because there does need, I mean, listen, I have to tell you, total honesty, I am involved with 2 children who are in the system and they're in my home now. So I'm specifically, it's personal to me. You know what I mean? It's personal to me having dealt with a DSS about this. Because families do need help. Families need help, but they're in the midst of the storm too, most definitely. But there is a way to help prevent if we can recognize some things, to prevent something from happening before it happens. And listen, I think we just have to be honest. Everyone that has a child isn't ready to have a child. So nevertheless, they still have the child. And we have got to protect our most vulnerable, just like elderly and innocent population.
Yeah, that's exactly right, Tre. And I'm not a parent myself, but I do have nieces. And I know even when I keep my nieces for the weekend, I need some help. I need some instruction. I need some guidance. So It is so true. All families need our support, not just those that are most vulnerable.
So tell us what the program entails.
Okay, so Thriving Families is really a new concept. So it's a completely new development that started at the federal level with lots of philanthropic partners and is now engaging state jurisdictions. And it involves stakeholders who work across all sectors. So public, private, philanthropic, all of the sectors that are engaged in helping families. And what we're aiming to do is help South Carolina create more just and equitable systems to benefit all children and families, like we talked about, through breaking harmful, often multi-generational cycles of trauma and poverty.
So what does that mean, Emily?
Yeah,
you know what I'm saying? That sounds like something, that you read. What does that mean? Just hard facts.
Yes. So some of what we're trying to do, some of the transformational aspects, because we keep talking about that Thriving Families is all about transformation, right? It's all about transforming a system not to or from a punitive child welfare system to a now child and family well-being system. And what that really means and what that looks like in hard facts for us is moving services upstream. So a lot of times right now, we only get involved after something bad has happened. So we want to move services, move our system upstream and help families thrive and really get involved in the community on the front end to provide those wraparound services. So it's things like building into communities holistic, robust, community-based interventions and services that are available for all families, regardless of race, regardless of ethnicity, and regardless of socioeconomic status. So it's treatment services, but it's also concrete services like helping with a water bill or helping to provide a crib or a safe sleep situation for a family. And it takes into consideration those social determinants of health too. So things like making sure that families know about child development, making sure they know about things like education and how to start with early development. And it adjusts all of the resources flowing through the system and how we keep ourselves accountable to be truly focused on that well-being of the children and families. So it is everything from community-based interventions from those specific services all the way up to what we call big P policy level at the federal and at the state level, changing the way our legislation looks to help us move towards that new system.
We're talking to Emily Parks. She's the Chief of Staff of the South Carolina Department of Social Services. We're talking about the new Thriving Families, Safer Children initiative. So, Emily, who qualifies for this? Are there families that are already in the DSS system?
Yeah, so we actually don't have a qualification process for this. So it's really looking at transforming at systemic levels for the system, but there's not an application process for individuals or communities to participate at this time. So where we are in the project right now, we've been involved in the project for about 4 to 6 months now, trying to form what this transformative vision looks like with partners across all of those sectors that I mentioned before. So right now we're working with those partners, the public, private, the philanthropic partners across the state to develop the vision of what Thriving Families will consist of. And our next phase of work that we're getting ready to dive into is diving into those community settings with individuals who live in communities, who work with families, who are the families, to get a better scope of what is actually needed within those communities and have the community's vision shape what it looks like to transform the way we work with families. Because we know that even though we do child welfare, I do child welfare every single day. I've done child welfare my entire career. I don't know what families in the upstate need. I don't know what families in Charleston need. They know what they need, right? So we need to dive into those communities and hear from the families about what they need.
So there will be actual, I guess, classes, for lack of a better word, services, information available in the specific communities for those folks who want it and need it to access it, basically?
Yeah. So essentially, it could look like that. So the first step is really to do focus groups, to do surveys with those communities to see what they need. And then if Charleston tells us we need a better service array for developmental classes, then it could look like implementing classes in those areas. It may be that they need more resources for food support or for childcare or family visitation centers or family well-being. It could be this variety of different things that are very concrete and often the simple things that we gloss over when we're talking about services that family or that community identifies that they need. And once we hear from the community, then we'll work to dive in and implement those services that they've identified.
Right. So if people, so if you're already in the DSS system, I'm sure the caseworker will let those folks that qualify, so to speak, that need that information about it, right?
Yes, exactly. So we already provide services to families involved with the system on a daily basis. But really, again, Thriving Families is about looking beyond just the system. So not just families who have had a called-in intake or not just families who may be involved in an investigation or in foster care, but those families that are already just in communities who may just need a little bit of support to wrap around them to make sure that they never have to come involved with the child welfare system at all.
Right. So you said you're now at the point, I know this initiative launched like in October. So yeah, it's very new. So I know, as you said, the first tier, I think you guys have 3 tiers, was to, as you said, kind of figure out what's needed and where it's needed. Are you still doing that right now, Emily? You still kind of exploratory phase, for lack of a
Yes,
better
we
word?
are very much in the exploratory phase of this project. So this work, this Thriving Families work, is unlike anything that any jurisdiction across the United States has ever embarked in, because it allows systems to think beyond federal metrics or federal reporting or even the restraints of federal funding or how we spend our state dollars. It really allows us to be creative in thinking about what would the utopian system look like, right? And when I say system, I don't just mean DSS. I mean healthcare. I mean Medicaid. I mean Department of Mental Health. I
It's
mean
all of that.
philanthropic partners.
Yeah.
Exactly. Any entity or agency who comes in contact with the child or family is a part of what we call this child and family well-being system.
Mm-hmm. All right. So how long will you kind of be in that phase?
Yeah. So we anticipate that the exploration phase, this focus group phase, could last anywhere through this summer.
Okay.
And then we're hoping at the end of the summer to be able to pick some pilot sites of communities where we can really dig in deeper and do this focused effort. And then at the same time, we're also looking at policy, at legislation, at all of these different things that affect what happens in communities. So it's really a two-pronged approach. It's diving into the communities, doing those specific interventions, but it's also examining policies to see, where do we have racial bias built into our policies? Where do we have implicit neglect or implicit bias around poverty or around how families live? Where is that built into our practice on a daily basis? Because we know we need to change that. We know it affects practice today, and we've got to reverse that in order to be able to truly wrap around families and strengthen. So it's really this two-pronged approach of diving in, doing direct work with communities, and then this larger systemic approach as well to get to this family well-being system that we're trying to achieve.
Yeah, we're talking to Emily Park. She's the chief of staff with the DSS. We're talking about the Thriving Families, Safer Children initiative. And Emily, I have to tell you, I love this because it is so much more about, the child is paramount, but the child is in a situation where there is a breakdown in the family. And sometimes it's no fault of the parents or the family.
Exactly.
Sometimes it is. Sometimes, listen, you can't do what you don't know. If you don't know better, you can't do better. But at least I love that you're saying you're looking, this initiative is looking at it to help the families thrive so that they not only can thrive, the children can thrive, because kids only can thrive if the family that they're living in is thriving. But the bigger thing is, Emily, is that the children and the parents, whoever's in that household, then goes into the community and can either make the community better or worse.
Exactly. That old adage about it takes a village it's not untrue, and it's not outdated either.
Yeah.
Families have to have a support system that wraps around them in order to be able to thrive. Families can't do it on their own. Individuals can't do it on their own. And exactly like you said, a child can't thrive if their family unit isn't thriving. And every child is a part of a larger family. That family may look differently, but they have a family. And so our goal is to wrap around and really strengthen that family through this initiative.
Yeah, you said it takes a village. It takes a village because it affects the village. And we have got to stop looking at it as them, they, over there. Yes. Because whatever happens in that household, as unproductive, as dysfunctional as it may be, they're not staying in that house 24/7 for the rest of their lives. They're going to come out and affect the family. And and like I said, this is personal to me because I am personally involved with 2 children that are in the system. And girl, I have to tell you, it gets frustrating sometimes. Because you've got to be able to seed into that family unit to make it better for them, so that the children who have, they deserve the best situation.
They do.
They deserve it. But you know what? So do the people in the household if they want it. Now, you can't make people do what they don't want to do, but at least it is. I truly believe in that. That thought of family, people helping people. If I know better, I believe it's those of us who know better to help those who don't. And it's not easy. It's not easy. We're talking about trying to change adults, but but it is necessary. So, all right, Thriving Families, Safer Children. It's being launched in South Carolina right now. So you're saying until around the summer, you're kind of in the exploratory phase. So,
Yeah.
one, is there something that the public can do to help you guys?
Yeah, so I think at this point, what the public can do is if you have recommendations of communities that you think would be especially open to pursuing this type of venture with us, let me know, and if I'll share my email address so Trey can post that as well.
Yes.
Yeah. So and then just really. What we're also trying to do and what the public can help us do is we're trying to change the perception around the families that we work with, which is so important. And it starts at every level, right? So this whole idea that oftentimes in South Carolina and across the nation, we confuse poverty with neglect. Poverty does not equal neglect.
That's right.
Poverty is a symptom of the system, and it is not the family's fault that they're in poverty. So we need to wrap around the family. We need to strengthen them. We need to help provide the services to help them get them where they need to be. So I think changing the perception around the families that we work with, that they're not bad people. Most of them haven't done anything wrong. They're a product of symptoms that they're living in, and helping us to really wrap around them, to strengthen them and build those community supports and relationships to help build them up.
Right. So you see Emily's information on the screen. So please contact her if, as a community member, you have some information that could share. And then once the program gets up and running, Emily, we'd love to have you and some of the other partners back to kind of talk about if people want the services or need to utilize the services, how they can do that. Talk a little bit before you leave about your partners.
Yeah, we have a lot of great partners who are engaged in this work with us. One of our forefront partners is Children's Trust. They are our leading prevention agency for the state of South Carolina, and they've really partnered alongside us to help vision what this will look like. We also have several other partners from across the state, including Department of Mental Health, Department of Alcohol and Other Drug Substance Abuse Services. We have Epworth Children's Home. We have law enforcement involved. We have the Office of the Child Advocate. We have philanthropic partners like Sisters of Charity and the Duke Endowment. So we really have a wide variety of representatives who have been engaged with the process and who have helped us really form what this vision might look like. And I only named a few, but there are many more. The team that's been forming this vision is around 50 to 60 people on any given week that we're talking through and visioning what this will look like. So it's a really robust team across all of those sectors that I mentioned who are helping to vision what thriving families will look like for South Carolina.
Yeah, that's good. All of those entities that you talked about are essential in making sure the family is thriving, because you're dealing with many of those things. Law enforcement, alcohol and drugs, mental health. Mental health is a big part of it also. So I love that. The collaboration is so important. Collaborate, because it is a multi-pronged challenge that needs to be addressed. So for more information again about Thriving Families, Safer Initiative, Emily's information is on the screen, and so please reach out to her and let her know that you heard about it here on Coping with COVID. Emily Parks, Chief of Staff of the Department of Social Services, thank you so much for joining us today, and for the work that you guys are doing to help our children and our families, because it makes a difference.
Thank you so much, Trey, and thank you for having me.
Absolutely.